Hello, my name is Ashley Baker, and today I'm going to be performing how to insert a Foley catheter. So before I begin, I have gathered my supplies. So I do have my insertion kit, my gloves, and my hand hygiene. And I did introduce myself as a student nurse to the patient. I did assess their level of consciousness. I did ask if they knew their name, date of birth, where they were, and what today's date was. They were alert and oriented. I did assess for allergies to iodine, betadine, and latex. There is no allergies. She is not in any pain right now. So I have explained to her everything that the catheter will help with and what she may feel while inserting it before, during, and after. So I am going to go ahead and begin. So I'm going to place my gloves. And these are non-sterile gloves. And I'm just going to turn my patient's sheet so that they have a corner facing up towards them. And I'm going to have her position her legs, knees bent and up, both legs. Okay, so she's done that, and now I will wrap the corners around so that whenever I pick it up, I will have a clear line of sight. Okay, and under that foot. And then on this side, the corner's right here. I'm going to wrap it around the ankle and under the foot. That way, whenever I pick it up, I can just pull it back and I have a full line of sight that's clear. So, just going to go ahead and pull this back. And right here is where I would perform peri-care. I would like to personally always start with peri-care with soap and water and not with the wipes. So I would perform that here. And then I'm going to discard my non-sterile gloves. And for demonstration purposes, I'm not going to throw them away because I'm going to reuse them. So just going to sit them off on the side of here. So I do have my kit. So opening my kit, pulling it out, and this will be my trash bag. So I'm going to roll it inside out so that whenever I clean her in just a little bit, I will have a place to discard my trash. Let me set that right here so I never turn away from my sterile field once I'm cleaning. So you can see my kit. Pulling my paper off, making sure my kit, can you see? Okay. Making sure to open away from me. And of course, I would do hand hygiene before I began with this. And you do start in the order that it is placed in here. So I'm just going to pull my sterile gloves out of the way. And in this kit, I do not see a drape that I'm going to place under the patient. So I'm just going to grab one real quick. I did just grab one that was not in this kit, so I'm going to place it on top of mine that is already cut. That will cover her perfectly. So this one would have been on top of my sterile gloves. And I'm going to grab the 1-inch border and let it fall. Grabbing just a corner again, letting it fall. And then shiny side will go down. And I'm going to place it under my patient, and I will have her pick up her hips and slide it under her. Okay, and now I'm going to perform hand hygiene. So I have performed my hand hygiene, and now I'm going to apply my sterile gloves. So, like I said with these, just so I can show you, I'm going to sit them right here on the bed like they would be normal sterile gloves. So, of course, I would open, oh, you can't see it. Can you see right there? Okay. Of course, I would open my package, open, and pull only from the edges. So now the outside of my gloves are sterile. So when I put on my dominant hand first, I'm going to grab the cuff on the inside, orient myself, and my hand will go in this way. Never let go. Never let go, you just pull till you get it on, and we will situate those in just a minute. So now I will reach inside the cuff. Careful not to touch the inside, because that will then contaminate my sterile glove. So orient myself. Sliding those on. So now that I have my sterile glove on, hands still in the outside, now I can situate my hands, because now my hands are sterile. So now that my hands are sterile, I'm going to reach in and grab my drape that is going to cover my patient. Again, shiny side down. Okay, it does seem to have fallen just a little bit, so I'm going to use my elbow to push it out of the way, because my hands are sterile. Draping my patient. Again, only touching the sterile areas. Only touching sterile areas. Okay. And I have familiarized myself with everything in my kit. So now I will be placing my kit down here so that I never turn my back on my sterile field. Just making sure my drape stays placed. So I will start with opening my swabs, and I will be using 5 of them. So we're going to start with 1, and we're going to clean down and discard. Sorry, I almost fell out of my hand. Down and discard. And then inside over here and discard. Then I will discard my package as well and open my other package. And clean down and discard. And then we will do one final one down the middle. Making sure she's good and clean. And then you could stop here and she is good and clean, but I just like to do one extra. So down and discard. Now my patient is ready, so I'm going to open my lubricant, squeeze it out, and place it in my tray, and discard. And I will take the tip of my Foley catheter and place it in the lubricant. And then here I will also attach my syringe and discard and attach my syringe. Okay, now that everything is ready, I'm going to my sterile drape. Keeps falling, but I have not contaminated my hands. I have not touched anywhere outside the drape. I'm going to